Here's what you need to about warts. What are warts? Warts are non-cancerous skin growths caused by a viral infection in the top layer of the skin or mucous membranes. Viruses that cause warts belong to a family called human papillomavirus (HPV). The appearance of a wart depends on where it is growing. Warts are usually skin-colored and feel rough to the touch, but can be dark, flat or smooth. There are several different types of warts. The first one I am going to tell you about is called common warts. Common warts grow around the nails, on the fingers and the backs of the hands. They are more common where the skin has been broken, for example where fingernails are bitten or hangnails picked. The second type of warts is foot warts. Foot warts are usually on the sole of the feet and they are called plantar warts. When plantar warts grow in clusters they are known as mosaic warts. Most plantar warts do not stick up because the pressure of walking flattens them and pushes them back into the skin. These warts often have black dots that are blood vessels. The third type of warts is called flat warts. Flat warts are smaller and smoother than other types of warts. They tend to grow in great numbers. They can grow from 20 to 100 at any one time. They can occur anywhere, but in children, they are most common on the face. In adults, they are often found in the beard area in men and on the legs in women. Irritation from shaving probably accounts for this. Many people can get warts and not even know they are there. It just depends on what kind of warts you come in contact with. Some warts can be painful and even cause burning just depending on where they are located on your body. Warts probably are passed from person to person, sometimes indirectly. The time between the first contact and the time that warts can be seen is often several months. The risk of catching hand, foot and flat warts are small. Wearing shower thongs, taking proper care of hands and feet can limit the spread of warts. Genital warts seem to be more contagious. It is important to use precautions to limit the spread of genital warts. Some people will get parts and some will not get them. It just depends on how they come in contact with them. If you do come in contact with warts, here's how you can get rid of them. Warts often disappear without treatment over several months to years. However, since warts can be spread to others or new areas of the body, it is reasonable to treat most people, especially if the warts are bothersome or painful. Some people will get them burned off with acid or freezing off it. These methods both can be painful, but it works. There are some wart remedies available without a prescription. However, you might mistake another kind of skin growth for a wart, and end up treating something serious as though it were a wart. If you have any questions about either the diagnosis or the correct way to treat a wart, you should seek medical advice. The causes of warts. When you are trying to detect a wart, the first thing you should look at is to try to compare it with your normal skin. A wart is a type of virus that will start to show up on your skin. Whether you know it or not, we are all exposed to viruses, and since warts are a type of virus, we can get them like any other virus. A lot of us cannot tell if someone may have a virus when we are around them unless they tell us they have been sick or exposed to someone who has been sick. The same goes for a wart. If you cannot see a wart on someone and you come into contact with them by just shaking their hand, you can get a wart. Even if the person you come in contact with does not have a wart, he could be exposed if he has been around a person who has a wart. We don't know why some of us are more likely to get a wart than others. The myth about catching a wart from a frog is just that, a myth. You cannot get a wart from a frog. There are methods a person could use to get some relief from a wart. Your dermatologist can suggest some of these methods that would work on you. One method is called the acid method. Using this method will destroy the tissue in the wart. Your dermatologist will give you a prescription that is a solution that you can apply to your wart for a month or two. The acid that your doctor will use is combined with salicylic and also of an acid called lactic. Another way your dermatologist might tell you is called a freezing method. I know all about this method because my husband's dermatologist does this method for his skin cancer. I will say this method is a little painful but is the fastest way to clear warts up. The doctor will use this spray can with a lot of force. The spray comes out pretty heavy and will freeze warts. The freezing actually will burn some. This procedure does not take long, usually only a few minutes. You will also notice in a few days that you may have some blisters that appear after this procedure. Do not be alarmed, they will go away in a few days. This procedure may sound very painful, but it is not that bad. It will get rid of warts. The burning of the procedure won't last very long. When my husband has it done, he can drive back home. One of the last resorts you may consider is what the doctor calls the slash and burn method. If you have tried all the other methods and they just won't work on you, this method will. Your doctor will apply to your skin a local anesthetic. After your doctor has applied this to your skin, you will feel nothing. He will use a needle that is electric, and this type of minor surgery will cut warts out. He can also use a laser to vaporize warts. The only thing that you may have to deal with is a little scarring. So if you are susceptible to getting warts, to remember that you do have an option of many different treatments. What you should do when a wart appears. Most warts disappear naturally, often within a few months, but can sometimes be years before they disappear. You may prefer to wait for this to happen. But if you do have warts that are bothering you either by the way they look or feel, you should seek treatment. There are 2 known cases where you should see your doctor rather than treating these warts with over-the-counter medicine or self-help treatments. The first type of wart is called penile or vulval warts. The other is if you have any other wart of any kind show up on your skin if you are 45 years old or older. In older individuals, what looks like a wart could be a more serious skin condition, such as skin cancer. There are 4 kinds of malignant melanomas. The typical appearance is a malignant melanoma. Usually this takes the form of a dark, slightly raised lump. Such a malignant growth that can look like a wart also can occur in an existing mole and cause it to enlarge and perhaps bleed. Another type is a large brown fleck on the face, which occurs in the elderly and takes 15 to 20 years to become malignant. A blue, brown, or black lump that bleeds easily, and a dark area that enlarges near the tip of a finger. So as you can see, warts can be treated if they are indeed warts. If however, you do nothing about the wart and it is not a wart, very disastrous things could become the outcome. So always look at what can be done for warts or any other skin condition you or a loved one may have. The elderly usually do not want to bother their family members for something they think is common, such as a wart, because they believe it is just from their aging and probably just spot that they get as they get older. If you are a family member of an elderly person, check their skin to see if they may have a wart of some kind or possibly a skin condition that needs to be treated immediately. When you know skin conditions that can occur on a person, you can help a person that may need answers about their possible wart or any other skin condition they may have. I have had to go to the doctor with my husband for his skin cancer, and what he has to go through because he waited too long is very unpleasant. He let one piece of skin cancer go too long that was on his temple, that he had to get it cut out. They had to cut very deep 5 different times to get the skin cancer out. So knowing what to do when you have any skin condition can be life-saving, whether it may look like a wart or not. Get it treated immediately for your protection or a loved one. For more videos, please like and subscribe.